Hi everyone, welcome back to the Doodle Nurse. Today we are diving into one of the most important foundations in psychiatric nursing and psychopharmacology, which is the brain map. We are going to connect the neurotransmitters, dopamine pathways, brain functions, psychiatric symptoms, and psychiatric medications. By the end of this video, you'll understand why psychiatric medications work, where they work, and how these neurotransmitter imbalances affect our mental health. So grab your coffee, notes, and let's simplify psychopharmacology together. Just a quick disclaimer though, this content is for educational purposes only, and it's not a substitute for professional medical advice, diagnosis, or treatment. Please always use your clinical judgment, follow your provider orders, and follow your facility protocols. So, have you ever wondered why low serotonin is linked to depression? Why too much dopamine can contribute to psychosis? Or why antipsychotics can cause movement disorders? Everything begins with neurotransmitters and brain pathways. The psych medications make much more sense when we understand the map. So today we will connect the chemistry to the clinical picture so that we can understand better symptoms, medications, side effects, and also patient care. We have to remember that if we know the chemistry, we also understand the mind. So first, what exactly are neurotransmitters? Neurotransmitters are chemical messengers that allow nerve cells, called neurons, to communicate with one another through our brain and our nervous system. These chemicals influence our mood, sleep, anxiety, motivation, learning, memory, movement, reward, tension, and most of all, emotional regulation. Basically, everything we think, feel, and do is connected to neurotransmitter activity. So when neurotransmitters are balanced, brain functions more effectively. But when neurotransmitter levels become too high or too low, psychiatric and neurological symptoms may happen. This is why neurotransmitters matter so much in mental health care. As nurses and future psychiatric nurse practitioners, understanding neurotransmitters help us understand our patients better, recognize the symptoms, anticipate the side effects, educate our patients safely, and most of all, understand how psychiatric medications work. Remember, this is not just behavior, it's the brain chemistry. Now that we have understand why neurotransmitters matter, let's look at the major neurotransmitters that we absolutely need to know. Think of these neurotransmitters as the brain's communication team, and each one has a unique role in mood, behavior, movement, cognition, and emotional regulation. So let's start with the dopamine. This is often called as the reward neurotransmitter. Dopamine plays a major role in reward, motivation, pleasure, movement, attention, and learning. When dopamine levels become too high, agents may experience psychosis, addiction, and impulsivity. Too much dopamine activity is strongly associated with the positive symptoms of schizophrenia, such as the hallucinations and delusions. On the other hand, too little dopamine may contribute to Parkinson's disease, depression, and low motivation. This is why dopamine balance is so important in psychiatric care. Next is the serotonin. This is the neurotransmitter most associated with mood and emotional stability. Serotonin helps regulate mood, sleep, appetite, anxiety, emotional balance, and pain perception. Low serotonin levels are commonly linked to depression, anxiety, OCD, and insomnia. Too much serotonin can lead to serotonin syndrome, which is a potentially life-threatening condition. This is why nurses must monitor patients closely when multiple serotonergic medications are being given. Now we have GABA, which is the brain's primary inhibitory neurotransmitter, and we can think of GABA as the brain's brake pedal. GABA helps calm brain activity, promotes relaxation, supports sleep, and reduce anxiety. Low GABA levels may contribute to anxiety, panic disorders, seizures, and insomnia. Medications like benzodiazepines work by enhancing GABA activity, helping patients feel calmer and more relaxed. Now, let's talk about glutamate. Glutamate is the brain's primary excitatory neurotransmitter, and it is essential for learning, memory, neuroplasticity. But too much glutamate can become harmful and lead to excitotoxicity, which can damage the brain neurons. And excess glutamate activity has been associated with seizures, neurodegeneration, and mood disorders. Glutamate receptors are also targets for newer psychiatric treatments such as the ketamine therapy. Now, for epinephrine, this is involved in the body's alertness and stress response. It affects our focus, energy, tension, blood pressure, our fight or flight response. Too little norepinephrine may contribute to fatigue, depression, poor concentration, and while too much norepinephrine it contributes to anxiety, panic symptoms, hypertension. So, this neurotransmitter plays a major role in anxiety and mood disorders. Now, for acetylcholine, this is important for memory, learning, attention, and muscle activation. Low acetylcholine levels are associated with Alzheimer's disease and cognitive decline. Some psychiatric medications block acetylcholine receptors, which can lead to anticholinergic side effects such as dry mouth, confusion, constipation, and blurred vision. So, older adults are especially vulnerable to these side effects. Now, for histamine, lastly, it affects our wakefulness, appetite, and allergic responses. Many psych medications block the histamine receptors, which can lead to sedation, increased appetite, weight gain, and this is why some antipsychotics and antidepressants can make patients feel sleepy or gain weight. Quick pearls, one of the most important things to remember is that neurotransmitters work in balance. So too much or too little of any of these neurotransmitter can cause symptoms and dysfunction. Psych medications help restore this balance within these neurotransmitter systems. So as nurses, understanding this chemistry helps us recognize the symptoms, monitor the side effects, educate our patients and their families, and of course, improve patient safety. Remember, know the map and we have to know the meds. Now that we understand the major neurotransmitters, let's move into one of the most important concepts in psychopharmacology, which is the dopamine pathways. If we understand these four pathways, psych medications and many psychiatric side effects will start making a lot more sense. Dopamine is not just a feel good chemical, it affects the reward, motivation, movement, cognition, and hormonal regulation. Different dopamine pathways have different functions throughout our brain, and when this become too high or too low, or even blocked by medications, Different symptoms can happen depending on the pathway involved. Before we discuss the pathways, let's quickly identify some important brain structures involved. Prefrontal cortex is responsible for planning, judgment, decision making, attention, and executive functioning. This area is heavily involved in our cognition and motivation. Hippocampus plays a major role in learning and memory formation. Damage or dysfunction here can affect the memory and cognition. Now, for amygdala, it helps regulate emotion, fear, and emotional responses. These structures become very important in anxiety and trauma related disorders. Hypothalamus helps regulate hunger, thirst, hormones, body temperature, and homeostasis. It also connects closely with the pituitary gland for hormonal regulation. Our cerebellum helps coordinate with our balance, movement, and coordination. Now, for the brainstem, it controls the vital functions, including our breathing, heart rate, and consciousness. Now, let's start with the mesocortical pathway, and this travels from the ventral tegmental area, also called as the VTA, to the prefrontal cortex. The mesocortical pathway is involved in our executive functioning, cognition, and decision making, also motivation. This activity, when this dopamine is low in this pathway, patients may develop negative symptoms of schizophrenia, like I mentioned earlier. They will lack of motivation, side effect, nerve deficits, and social withdrawal. And these symptoms are often harder to treat than hallucinations and delusions. And this pathway also help explain why some patients with schizophrenia struggles with motivation and emotional expression. Next is the mesolimbic pathway. It's often called as the brain's reward pathway, and this travels from the VTA to the nucleus accumbens within our limbic system. The mesolimbic pathway controls reward, pleasure, reinforcement, and emotion. When dopamine activity becomes too high here, positive symptoms of schizophrenia will happen, including the hallucinations, illusions, and agitation. This pathway is also strongly linked to addiction and impulsive behaviors because rewarding experiences increase dopamine release here. Most antipsychotic medications target this pathway to reduce the psychotic symptoms. Now, let's discuss the nigrostriatal pathway, and this travels from the substantia nigra to the striatum. Its primary role here is movement control and coordination. So, when dopamine is low in this pathway, Parkinsonian symptoms such as tremors, rigidity, and bradykinesia will happen. Here's the important psychopharmacology connection. When antipsychotic medications block dopamine in this pathway, extrapyramidal symptoms or APS can happen. Examples of APS are dystonia, akathisia, Parkinsonism, and tardive dyskinesia. As nurses, recognizing APS early is extremely important for patient safety and medication management. The last major pathway is the tuberoinfundibular pathway, and this connects the hypothalamus to the pituitary gland. The main role is prolactin regulation, normally when dopamine suppresses prolactin release. But when antipsychotic medications block the dopamine in this pathway, the prolactin levels rise, and this can lead to galactorrhea, amenorrhea, gynecomastia, sexual dysfunction, and infertility. And these side effects can significantly affect medication adherence, so patient education is very essential. One of the most important things to remember is this: different dopamine pathways have different functions. So when medications affect dopamine, the effects and side effects depend on which pathway is being affected. For example, blocking the dopamine in the mesolimbic pathway, it can reduce psychosis, but blocking dopamine in the nigrostriatal pathway may cause APS. And blocking dopamine in the tuberoinfundibular pathway, this will increase the prolactin levels. And this is why understanding these pathways can help us nurses and future psych NPs anticipate the side effects and provide the safer patient care. Remember, different pathways have different functions, but they have the same goal, and this is balance. Now that we've explored neurotransmitters and dopamine pathways, let's connect everything together by looking at how these neurotransmitters affect the major brain functions and what happens when these systems become dysregulated. This is where psychopharmacology becomes clinically meaningful, and different neurotransmitters influence different brain functions such as mood, motivation, movement, sleep, memory, and stress response. So, when neurotransmitter systems malfunction, psychiatric and neurological symptoms may happen, like I mentioned earlier. On the mood and emotion, this function is heavily influenced by the serotonin, dopamine, and norepinephrine. These neurotransmitters help regulate our emotional balance, like I mentioned earlier, for happiness, motivation, energy, and emotional responses. When these symptoms become dysregulated, patients may experience depression, anxiety, bipolar disorder. For example, low serotonin is commonly associated with depression and anxiety, and therefore changes in this dopamine and norepinephrine. It can affect the energy, motivation, and emotional stability. And this is why many antidepressants work by increasing serotonin and or norepinephrine levels. For the reward and motivation, this function is strongly connected to dopamine, especially within the mesolimbic reward pathway. And like I've mentioned earlier, dopamine helps drive the motivation, pleasure, reinforcement, and the reward seeking behavior. In this pathway malfunctions, patients may experience the addiction, schizophrenia, and anhedonia. Anhedonia means losing the ability to experience pleasure. Patients may say, "Nothing makes me happy anymore," or "I don't enjoy things like I used to." And this is very important symptom in depression and schizophrenia. On the sleep and arousal, they are influenced by GABA, serotonin, and histamine. And these neurotransmitters help regulate our sleep cycles, regulation of the relaxation and wakefulness, and most of all, our sedation. When these symptoms malfunction, patients may experience insomnia, hyperinsomnia, and poor sleep quality. These symptoms explains why some psychiatric medications can cause sedation, daytime drowsiness, and increased sleepiness, while other medications may increase alertness and contribute to insomnia. On cognition and memory, it involves several neurotransmitters, including the acetylcholine, glutamate, and dopamine. These neurotransmitters influence our learning, attention, memory formation, and cognitive processing. When dysfunctions happen here, patients experience cognitive impairment, memory loss, Alzheimer's disease symptoms, and this is why anticholinergic medications may worsen confusion, especially in older adults. So, protecting cognition is an important consideration in psychiatric medication management. Lastly, is the stress response. Let's discuss it by involving the norepinephrine, CRH, or also called corticotropin releasing hormone. These chemicals activate the body's fight or flight response. When this system becomes overactive, patients will experience PTSD, anxiety disorder, panic disorder, hypervigilance, and patients may feel like constantly on the edge, easily startled, and unable to relax. This is why stress regulation is such an important part of mental health treatment. For our nursing pearls, psych nursing involves much more than simply giving medications. Nurses play a critical role in assessment, monitoring, education, safety, and most of all, therapeutic communication. Assess always the mood, thought content, side effects, suicide risk, and patient safety. Remember, changes in behavior may reflect changes in neurotransmitter activity or medication side effects. And we have to always monitor labs because some psych meds require important laboratory monitoring, includes the lithium levels, CBC monitoring for clozapine, metabolic panels, and lipids or A1C levels. Monitoring helps prevent serious complications and promote safer care. We also have to teach patients that medication's purpose and expected side effects, when to seek help, and importance of the adherence. Patients are more likely to continue the medications when they understand why they are being prescribed. Watch for red flags. Always monitor for serious side effects, including the serotonin syndrome, neuroleptic malignant syndrome, or NMS, also APS, lithium toxicity, and metabolic syndrome. Early recognition can always save lives. On our therapeutic communication, finally, we should never underestimate the power of therapeutic communication. Building trust with our patients improves their medication adherence, safety, outcomes, and also emotional support. Patients need compassionate care just as much as we need more medications. For our final takeaway, brain functions through balance. So when neurotransmitter systems become dysregulated, psychiatric symptoms will appear. Psych medications aim to restore the balance, and nurses help patients navigate that journey safely. So we know that chemistry, we have to understand the mind, and also, most of all, it improves patient care. Now, let's connect everything together. Psych medications work by affecting the neurotransmitters and brain pathways. Antipsychotics, they are the medicines that mainly block dopamine receptors, and this help reduce the psychosis. But nurses must monitor for EPS, prolactin elevation, and metabolic syndrome. For antidepressants, it increases the serotonin in or norepinephrine. This help improve our mood, anxiety, energy, motivation. Examples for these are the SSRIs, SNRIs, TCAs, and the MAOIs. We will make a separate content for all of these medications, so don't worry. On our benzodiazepines enhances the GABA activity, and it promotes our calmness, relaxation, and sleep. But also, we have to monitor for sedation, falls, dependence, and respiratory depression. Mood stabilizers, they help the transmitter stabilize the neurotransmitter signaling. And this includes the lithium, valproate, and lamotrigine, also commonly used in bipolar disorder. On our stimulants, the stimulants increase the dopamine and norepinephrine activity. and it is used for ADHD and narcolepsy. These medications improve the attention, focus, and alertness. Psych nursing is not just about medications, but it's also about assessment, safety, education, and therapeutic communication, like I've mentioned earlier. And we have to always remember that patients are more than diagnosis. Therapeutic communication, they help build trust and improve outcomes. Thank you so much for learning with the Doodle Nurse. And if this video helped simplify the psychopharmacology for you, please like, share, and follow. You can find me on YouTube. This is the Doodle Nurse for you. Keep learning, keep growing, and keep making difference in your patients' lives. Remember, know the chemistry, understand the mind. And disclaimer, this content is for educational purposes only, and it's not intended as a medical advice, diagnosis, or treatment. Please always follow the evidence-based guidelines, provider orders, and facility policies. Thank you. Have a good one.